Okay. So I am very, very pleased today to introduce three incredible experts on community-based healthcare for older adults from our area agencies on aging. First, Felicia Sanchez represents the Southeast Washington Aging and Long-Term Care, which serves Assateague, I'm pronouncing it wrong, Benton, Franklin, Columbia, Garfield, Kittitas, Walla Walla, and Yakima counties. Feel free, Felicia, to correct my pronunciation. She's worked in the healthcare industry for over 20 years before transitioning into her role as Southeast Washington Aging and Long-Term Care. And she has her undergraduate degree in psychology from the University of Washington. She enjoys working with patients and alongside healthcare professionals to educate and assist with patient needs. Breanne Swanson represents the Area Agency on Aging and Disabilities of Southwest Washington. Since 2012 there, she has worked in case management, program coordination, led caregiver support groups, taught evidence-based workshops, and supervised staff in a busy aging and disability resource center. She's currently the agency's primary care liaison, the single point of contact for healthcare providers. Her goal is to enhance clinical teams' awareness of community resources that support older adults to age in place. Breanne earned a Master of Science in Experimental Psychology with a focus in gerontology from Western Washington University. And Phung Nguyen is the primary care liaison at Aging and Disability Services for Seattle and King County AAA. She also supports the Care Transitions Program, coordinating services for adults transitioning after hospitalization. She's a change team lead for the City of Seattle's Human Services Department, supporting the Race and Social Justice Initiative to advance diversity, equity, and inclusion. She serves as the department's language access liaison to help with the development and coordination of language access work plans and activities citywide. Phung has dedicated more than 15 years of her career in addressing the health and social barriers of vulnerable populations. Her family came to Seattle as Vietnamese refugees in the early 90s, and she's the first in the family with a college degree in psychology from the University of Washington and a Master of Public Administration from Seattle University. And they're here today to talk to you about area agencies on aging. Welcome, 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 and I'll turn it over to Felicia.
Perfect, thank you. Can everyone hear me okay, Bob? Okay, good. So thank you again for joining us today on our presentation for the Area Agencies on Aging. Breanne, myself, and Phung are excited to have you and hope that you find some really useful information. So first, the disclosures. There's no disclosures. However, the views and the opinions of this presentation are that of the presenters, not necessarily represent the official views of HRSA or the U.S. Department of Health and Human Services. So the objectives for this evening, to give you a little bit of background about what a AAA or Area Agency on Aging is, tell you more about the resources and why the AAA are useful to healthcare teams, as well as the role of the AAA and how we can help your patients, how you can access the AAA services, as well as how the AAAs can support age-friendly care.
So just to give everybody a little background before we get started, I always like to share a little bit about a time that I met with a large group of nurses at one of our local hospitals. So I gave a presentation on what an agency on aging was, and the very first question I got when I finished up was, well, this is all well and good, but isn't that the social worker's job to know about this stuff and refer patients to you guys? Which really threw me off. It was a surprising question for me to hear. So it turns out that this team of nurses was unaware that not every patient in the hospital is actually going to see the social worker. And I like to point this out because, yes, it is traditionally the social worker's job to make these types of referrals. But I just want us to keep in mind that not the entire patient population is seeing the social workers. It's generally a pretty small group of folks. And those are the folks who are exhibiting those typical red flags that need a social worker's support. So when we think about the patient population in general and older adults, those folks, there's going to be a big group of folks who are missing out on possibly referrals like to an agency on aging because they don't raise those traditional red flags that would warrant a referral to the social work team. So just something to keep in mind today as you're listening to our presentation. Think about those people like those family caregivers, those people who are coming into appointments with your patients, those other people that are helping out in making the patient successful in their healthcare goals. So just keep those folks in mind as you listen to our slides today. That's it.
Perfect. So first, let's have a little history lesson. So the Older Americans Act. In 1965, Congress passed the first federal initiative called the Older Americans Act. Sometimes we refer to it as OAA. In response to concerns of the lack of community social services for older Americans. OAA is a major vehicle for meeting the diverse needs of growing numbers of older adults in the United States. It empowers the federal government to distribute funds to the states for supportive services for individuals over the age of 60. OAA funds critical services that keep older adults healthy and independent. The continued goal of the Older Americans Act is to support older adults living at home with dignity and independence for as long as possible. Now, you may have heard of the term the aging network. This refers to the interconnected structures of agencies providing services headed by the Administration on Aging. The National Aging Network includes 56 state units on aging, over 600 agencies on aging or AAAs, and more than 260 Title V Native American aging programs. And we can't forget the support by tens of thousands of service providers and volunteers. Now, area agencies on aging were established as a result of the Older Americans Act in 1973. They were designated by the state to address the needs of and concerns of older people at more of a regional and local level. The Area Agency on Aging really is kind of the on-the-ground organization to help older adults live with independence in their communities, and generally the communities of their choice, which is their home. The AAAs play a key role in planning, developing, coordinating, and delivering a wide range of long-term care services and supports. AAAs love partnering with healthcare providers such as yourself to improve the health of older adults by engaging in innovative services. We coordinate and offer services that help older adults remain in the setting of their choice. And as I mentioned, that's generally they want to remain in their homes. We can access community needs by addressing the communities at large and seeking what they feel their community needs for services, which leads to the development of the innovative programs that I mentioned. We serve as a portal of care to provide the needs of the clients or your patients so that they can get the supports that they need. So the OAA requires AAAs to provide 5 core services that you can expect to find in any region that you may reside. Those 5 core services are elder rights, which is the protection and prevention of elder abuse, caregiver programs, which provide family caregiver support, nutrition, specifically senior nutrition programs, as well as health and wellness, providing evidence-based health programs and supportive services, which such as transportation, job training, building community-based support networks, and access to information and services for in-home care assistance. The average AAA offers many more additional services. The common non-core services include insurance counseling or better help understanding Medicare, as well as case management. Now, researchers in a 2019 study published in the Journal of Medical Care found that AAAs have the strongest and most well-built networks. AAAs are the hub that connects older adults to necessary services, such as transportation, Medicaid agencies, advocacy group, nutrition programs, and even energy assistance. With the help of medical providers, we can help improve the health outcomes of patients by connecting individuals to our AAA services. Older adults generally trust their providers to be aware of community resources that could help. So just knowing of the AAA and knowing that it exists can make a huge impact and benefit your patients. So who do we serve? Well, in general, all AAAs serve the same populations. However, it may differ by AAA and their region. But overall, the AAAs serve older adult populations age 60 and older, Medicaid long-term care clients age 18 and older, unpaid family caregivers age 18 or older. And we have priority populations such as vulnerable adults, those with low income, individuals with poor health, and individuals with dementia and or Alzheimer's disease or disorders, limited English proficiency, as well as rural residents that may be experiencing social isolation, and individuals at risk for institutionalization or being placed in a long-term care facility.
Thank you. So now we're going to get into some of the different examples of what are some of the different services that kind of fall into those categories of those 5 core services that are available at every single agency on aging. So the services that we're going to talk about next, these are likely going to be available to you locally, but they may look a little different depending on where you are. So urban areas may have more robust resources than really rural communities. So I think if you take one thing away from the presentation today, it's knowing that agencies on aging are often where you can find information and referral or information and assistance programs specifically for older adults. Oftentimes those are also called Aging and Disability Resource Centers. So you may see that terminology as well. So really what these information and referral programs are for is they're the front door for services for people who need help or support. They really serve as a single point of contact to help people understand and become aware of the different services and supports that exist in their communities. They can get their questions answered at these places. They can go learn about the different referrals that can be made, the different services that exist in the community, and the different programs that exist within the Agency on Aging. So the folks who work in these information and referral centers, their goal is really to help connect people to the appropriate services that exist. They answer a lot of questions, like they can help people figure out where can I find food resources, but they can also do screenings for different programs that may exist within the AAA. They provide a lot of information to folks who are calling in. They can even do some advocacy for folks who maybe not be able to do advocacy on their own behalf. And the great thing is that when you're connecting a patient to an Agency on Aging's information and referral center, you're going to be getting unbiased information. So their goal here is not to connect you to a specific business or a specific resource because they're getting financial kickbacks from those groups. Really, you can trust that the information that you're receiving in these areas is non-biased. It's going to be great information. So it's a really good resource to keep in your back pocket. It's a great place to call if you just want to know about the services that exist in your community. Next, please. So throughout the presentation here, we'll also kind of give some examples because I really think some case studies help paint a nice picture of how real patients are interacting with these programs and services. So this is a gentleman who is an 87-year-old man who had come into the clinic for his annual wellness visit. And so his physician sent a referral to our agency, and that referral indicated that the patient was really struggling with his balance. He had fallen in the shower recently. He was having trouble preparing meals, and the referral to us indicated that the doctor said he needs a caregiver, but this patient was very opposed to having somebody come into his home. That can be a very invasive step for some people. Maybe they're not quite ready to get that type of help yet, which is all right. So the great thing about the information and assistance teams is that they like to meet the people where they are. It's not our job to force services on people. We really like to help understand what their needs are and what they are actually wanting to receive help with, and help them connect to services in that way. So as a result of interacting with our information and assistance team, our assistance specialist spoke to the patient, and they learned that he doesn't actually have any safety equipment in his shower, and that he can't stand long enough to cook, so he's mostly been eating cereal. So what we did was we connected him with our local equipment bank, because we have a great place that has free equipment. You may have one of these in your community too. He was able to go get a free bath bench and some free grab bars to install in his home. And we also made a referral for him to home delivered meals so that he could get something a little bit more nutritionally balanced than the cereal he had been eating. So you can see we were able to help connect him to services that he was willing to accept. Hopefully, that's going to help establish that rapport with him. And then maybe eventually in the future, if he does decide maybe he's ready for kind of the next step of services, or if he's needing something like in-home care, he would be more comfortable returning to us to access those services. Next, please. So the next thing that you may be able to find at your local agency on aging is the statewide health insurance assistance program. So essentially what this is support that's provided by volunteers for all things Medicare. They can help answer questions about Medicare benefits. They help assess people's coverage needs. They can help them figure out what may be the best program for them to get on in terms of coverage, and it helps them evaluate different policies. It's also a great place for people to go to issue complaints about Medicare that they have. So the nice thing about the SHIP programs is that they are pretty popular. Felicia mentioned earlier that they are one of the most common services that an agency on aging offers. And the other great thing is that, again, this is unbiased information. These SHIP volunteers are not affiliated with any single Medicare plan, so we can be sure that the information that the patient is being provided with is going to be just totally fair and balanced. They're going to get connected to what fits them best. So I'm not going to read the whole quote here, but what I want to call out from it is this is a quote from an older woman who was a SHIP client who interacted with the volunteers because she was having trouble paying for her premiums. So one drug was costing $41. And then after she was working with the volunteer, it was just $3 when she was able to switch her coverage. And I just love her quote here. She's saying, older adults, they may have to choose between food and a prescription, which is probably something that a lot of you guys have heard before. And these folks don't know that this type of help is available to help them figure out ways to maybe save money on their drug premiums and their healthcare costs just by interacting with this volunteer service. Next, please. So the next service that's a core service that I want to talk about is services for unpaid or informal caregivers. So you can find services for unpaid or informal caregivers at any single agency on aging across the country. What those individual services are going to look like is going to depend on your specific location and what's being offered. So in general, a family caregiver is somebody who is routinely helping a friend, a neighbor, or a loved one, and they're not paid to do it. So these are not professional caregivers. These are folks who are just helping with your day-to-day ADLs or IADLs. Maybe it's just something like, helping mom coordinate appointments, but maybe it's something more in depth, like helping give somebody a shower. Many of these folks who, I guess us at the AAAs would identify as caregivers, they're not going to think of themselves as being a caregiver. They think of themselves maybe more as just, someone who helps their mom on the weekend. But really, they're a caregiver, and that job can be stressful. It comes with a lot of responsibilities. Over half of people who are providing care to a loved one feel overwhelmed by the amount of care that their loved one needs. And 8 out of 10 of them feel that they could use more support and information in their role as an unpaid caregiver. So oftentimes caregivers are family members. Typically that's our lingo. We refer to them as family caregivers, but they don't have to be family. They could be a friend or an acquaintance or a neighbor or something like that. the biggest thing is here is that they're providing care and they're not paid to do it. They're not a professional. Next. So the other thing that I would like to point out is that family caregivers are really critical to health outcomes for patients. So more and more as the years progress, caregivers are taking on these tasks that are formally provided by professionals, and they're also doing so without training. So the stats here, we have 57% of these unpaid caregivers are helping with medical or nursing tasks. And 78% of those folks who provide those types of things are managing medications, they're administering IVs, injections, and medications. So these are serious things that they're doing. And 42% of these folks are doing these types of tasks without any sort of training. So if we think about that, these folks are really, really important to the health outcomes of your patients. They are, the quote down here, they are the linchpin to our healthcare system, particularly for older adults. So we just like to point that out, that you keep these folks in mind because they have a difficult job and they will often tell you they've got it, everything is fine. It's what they signed up for, you know, when they married their spouse. It's what you do for family. A lot of people will say that. And they don't know that there is help available for folks like them. Next, please. So family caregivers, they can get very overwhelmed. Not everybody does, but caregivers are going to be a lot more likely to experience depression, feel burdened, feel overwhelmed, feel anxious about the care that they're providing to their loved one. So if we can figure out a way to wrap support around those caregivers and help ease those burdens, make the care easier, what we're doing is hopefully helping delay placement into a facility or reducing the likelihood that their loved one is going to end up in the hospital. So we have these programs at Agencies on Aging that is specifically designed to provide caregiver support. So we wrap services and supports around that unpaid family caregiver themselves. So they are technically our client on these programs, which is a little different than most of our other programs. We will assess them to figure out kind of where they're at on their caregiving journey. We can help them find respite care to get a break from caregiving. We can help them figure out plans for the future. Like, what does it look like maybe when my loved one needs to be placed? How do I figure out when it's time? How am I going to pay for that? We can help them connect to different support groups that might exist in the community so they can connect with other caregivers, because caregiving can be a very isolating experience. We can help them find other local resources that exist. They're going to make their lives easier. So an example would be like incontinence supplies. People may be purchasing those and it's really putting a strain on their finances, but maybe they don't know that there's a way that they could get those for a lower cost. And we can also help people obtain like specialized training and education. Again, what's available is going to depend on where you are and what state you're in. But typically these are things that are available to help support family caregivers through Agencies on Aging. Next, please. So again, we have another case study here. So the patient was a 70-year-old woman with dementia who had been hospitalized due to a urinary tract infection. So the reason that the healthcare team referred her to us was that she needed help with her activities of daily living. The referral to us indicated that her husband is her caregiver. He's really involved in her care, but he has been struggling to bathe her, is what we found out, and says that she can be pretty aggressive with him, which rightfully is stressful to him. He's feeling pretty overwhelmed, but he is adamant that he wants to keep her at home. So just kind of a little caveat here, oftentimes when we talk to men, especially husbands who are caregivers, they really like to tell us they've got it. You know, this is what they signed up for when they were married. Their wife would do it for them, so they are happy to do it for their wives, and they are reluctant to express that they really are feeling stressed and could use some support. So what we did is our team in the intake, in the information and resource area, they talked to this gentleman and they found out a little bit more about what was going on with him and his wife and what he was struggling with, and let him know that help is available for people like him. So what we did is we referred him to one of our family caregiver support programs. We provided him with a case manager to consult with when he needed it, because for some caregivers, just having access to a case manager can be like having access to a life jacket in a storm, just something to reach out to help you when things are feeling overwhelming. This gentleman was encouraged by the case manager to maintain his regular doctor's appointments because, big surprise, caregivers often put their own health on the back burner when they are taking care of a loved one, because they are so focused on their loved one's health, they're neglecting what needs to be done for themselves. It's not uncommon that we see caregivers pass away before the person they're taking care of. So this gentleman was connected to a dementia support group to help him meet other caregivers in his situation. We also gave him some educational information and resources about dementia, just to help him understand more of the disease process, to help make that care more manageable. And we also authorized him for 20 hours of in-home respite care. So respite care is likely something that's available in other states, but there may or may not be a waiting period for that. Next, please. So the next core service I want to talk about is senior nutrition. So I want to back up just a tiny bit. Felicia mentioned the core service area of nutrition. And I always like to share that most people are aware of home delivered meals. I'm sure all of you have probably heard of those, but what most people don't realize is that agencies on aging are kind of the stewards of the funding for senior nutrition services. So agencies on aging may not be the actual group that is providing the meals. We may not be the name that's on the side of the van that's driving around delivering meals, but we are the stewards of the federal funding that helps provide those meals. So like our agencies on aging, for the three of us, we contract out with other nutrition providers to provide home delivered meals in our communities. So that's kind of nutrition a little bit in a nutshell. So within the nutrition core service, there's a couple different ways we might meet that need. So one of those is congregate meals. So congregate meals are really neat. Those are meals that are served in a community setting. And these are really great because they support socialization. Overall, that's not the main goal of the program. The main goal is providing that healthy, nutritious food, but it's kind of a little side effect of having people together in a room eating together. Most of these sites should be back open again after the pandemic. So that might be something to check into if you have a patient who is feeling lonely or isolated, having trouble meeting their dietary needs. They may have a congregate meal site that's available to them in the area that they could go meet some other folks and access a nutritious meal. Those often happen in like community centers or like boys and girls clubs, Grange halls, those types of places. The next service that's available, and we'll hear a little bit more about this in a minute, is home delivered meals. So home delivered meals, I'm sure you guys know, these are for homebound individuals who have trouble preparing their own meals. So sometimes these are going to be daily deliveries of hot meals that are ready for people to eat. Sometimes they might be like a once a week delivery of frozen meals for people who are, able to use their own microwaves to heat them up. But it's great because it provides a routine person who's going to the door to that house, who knows that person, who knows when they're doing good, maybe when they're not doing so good. And what would happen then is if that volunteer senses that there's something amiss, they're going to report back to their agency they're affiliated with. And hopefully that feedback can get back to the appropriate folks. So either their emergency contacts, maybe even their providers, if the doctor is listed as an emergency contact. It's just a great way to get that feedback to the folks who need it if there's something wrong. Another thing that might be available in your communities is the Senior Farmers Market Nutrition Program. This is another really neat program that provides vouchers or cards that people can use to buy fruits and vegetables at their local farmers market. The amount that would be available for, like the dollar amount, would probably vary from place to place, but like locally in my area in Southwest Washington, people are eligible for $80 of nutrition vouchers that they can use at the farmers market. And these are really popular. I know our agency does a lottery system with them because they are a very hot commodity with seniors. So you may want to check in with your local agency on aging if something like that is available in your community. So next, we have a little video that I want to show you guys. This just, I think, does a really nice job painting a picture of what home delivered meals are and how they're impacting people. We filmed this early on in the pandemic in our local community here in Southwest Washington. It's from a city called Longview, which is, I guess it's in a rural county. It's a pretty small community. And so Felicia, I'll let you go ahead and play that for us.
I'm Tammy Davies, Program Manager for the Senior Nutrition Program at Lower Columbia CAT, serving Cowlitz and Wahkiakum counties in Southwest Washington. Our primary mission is to serve people that are 60 or older that are trying to stay in their homes and are having difficulty cooking meals for themselves, accessing food in some ways, and are nutritionally at risk. The home delivered meal program is really important to our clients because of the nutrition that it provides and the social connection that it provides to the community. We rely heavily on volunteers to deliver our meals, and they are a presence to our clients. So when they deliver that meal, they get to see somebody, they get to interact with somebody, and a lot of times it's the only person they interact with all week long.
Well, my favorite part about volunteering is seeing the smile on the people's faces and the happiness they get from us showing up at their house with a nice healthy meal for them.
So the drivers are a really important connection to the community. They get to know their clients and they get to know their routines and how they answer the door, or if they don't.
We are the eyes and the ears for these people, and we can see changes with these people if there's a health issue or a problem, or maybe they've fallen and didn't tell anybody. I mean, they probably don't have a lot of contact with a lot of people. We might be the only people they see for a week or a few days. So it's a good way for us to keep our eyes and ears open for them.
Most of our clients have some sort of physical or even memory issues, things that prevent them from providing their own nutrition. And when their nutrition needs are not being met, their chronic illnesses become worse. So if a meal once a day can change that for a senior, it's definitely worth the dollars involved to do that.
It's nice to have a hot meal at least once a day. I can't stand it to cook a normal meal because I can only stand about 5 minutes or so until my back starts hurting really bad.
So if you're a senior at home, isolated in that way, being able to interact with someone is important. We can meet needs. We don't turn people down. Someone else is not going to not get a lunch because you take one. And I think people are not willing to say, this will make such a difference in my life, until they get started and they're like, wow, this is so great and what a difference this makes to my whole day. I don't use all my energy up trying to make my dinner, and so I actually have energy to do other things and to have more quality of life, and we can help them do that.
Sorry, I forgot I muted myself. Next, I'm going to talk about the core service area of supportive services. So this is kind of like the catch-all for the everything else that agencies on aging do. So in some areas, there might just be a couple different programs that fall into this category. Oftentimes, this is where you'll find transportation programs, case management, in-home care, house cleaning services, those types of things. But today I'll talk to you about some of the more popular ones that you're more likely to be able to find at other agencies on aging. So we'll start off with case management and care planning. So agencies on aging often have case managers, care planners, care coordinators. There's a bunch of different names for what they do, but these are essentially folks who work with clients to develop a plan of care, oftentimes for in-home care services, if that's available in the local community. These folks, the care managers, their job is really to assess the patient's ADL and their IADL needs, and they create the plan of care based around those needs. Their job is to authorize the different services that are available. So in some areas, like in Washington, we're really lucky. We have very robust services. People can get things like in-home care, but also things like a life alert button, or maybe incontinence supplies, things like that. So the care manager, the case manager, it's their role to kind of coordinate all of those services and make sure that they're actually being authorized in a timely manner and delivered in a timely manner. So the case manager is also the go-to person that can help resolve client concerns or complaints that they may have. And the case manager also periodically checks in on those clients to make sure that the service plan that's put in place is actually meeting their needs. Because so often, people, they may have a fall or, a downturn in their health, and the case manager may not have been notified about that. So they check in with their clients periodically. Next. So another thing that agencies on aging offer, I touched on it just a little bit, is in-home personal care services. Because the whole goal, right, of an agency on aging is to help people age in place, not have to go to a facility. In-home personal care services are a great way to do that. So these are really designed to help people stay in their own homes where most people want to live and not have to go and get placed in a facility. So the caregiver in this sense would be a paid caregiver that comes to work in the patient's home, and they help them with the various activities of daily living and the instrumental activities of daily living that person needs help with. Oftentimes, in-home care programs are going to be via Medicaid in-home care waivers. A lot of states offer those. I don't know that all of the states that maybe you may be from would offer those. There are still some states that do not offer in-home care waivers, but your local agency on aging would know if that is something that's available in the area. The other thing to keep in mind about in-home care services, even if they're available, there may be lengthy wait lists to access those services. So I always think it's good to get patients thinking about these type of services, maybe even before they need them, so they can be informed and aware of what would be available for them in the long run. Next, please. So I think the last case study I'll share with you here is just kind of about how people are interacting with case management and in-home care. So the patient was a 67-year-old woman with diabetes, and she had her leg amputated. She had had quite a few falls while wearing her prosthetic leg, and her doctor instructed her to ambulate using a wheelchair because she was no longer safe wearing her prosthetic. She also had really bad neuropathy in her hands, and it caused her to get frequent burns when she cooked, and that unfortunately led to the amputation of multiple fingers. So she was really struggling. This is a person who's having a very hard time at home. We can kind of see there's a decline in her functioning, and there's likely going to be something that is going to happen that is going to make her need a lot more care or support, or maybe end up hospitalized or placed long-term. So the healthcare team referred her over to the Agency on Aging, and our information and assistance team talked to her to figure out if there were any sort of programs that she'd be eligible for. So we figured out she would be eligible for one of our Medicaid in-home waiver programs, and we got her connected with that. So ultimately, she was approved for 20 hours of in-home care, which, although it doesn't sound like a lot of help, it was just enough. Just that little bit of help was helpful to get somebody who could cook for her from time to time, help get her to medical appointments, help her with some of those activities of daily living that she was struggling with, and just really help her stabilize so that she wasn't having to go back to the hospital or get placed in a facility. So it was really life-changing for her. And Phung, I'll pass it to you.
Thanks, Breanne. So another core service area of the AAA I wanted to talk about is health and wellness. Health and wellness focuses on promoting the health and wellness of older adults and adults with disabilities. Health promotion is a process of empowering people to self-manage and improve their own health through health education, chronic disease prevention and management. And some of the evidence-based health programs that we offer are Pearls, also known as program to encourage active, rewarding lives for veterans. Another program is Powerful Tools for Caregivers, A Matter of Balance, Enhanced Fitness, and Living Wells, which is a chronic disease self-management education programs for chronic conditions and chronic pains. There are many other evidence-based health programs, promising practice, and evidence-informed health programs, also known as health promotions. And they all vary in each county and state. So be sure to reach out to your local AAA to confirm what is available in your area. Next slide, please. We can also help promote health and wellness of older adults by using the self-management plans or flags as patient education materials for common chronic conditions like managing chronic pain. Here is an example of what a self-management plan looks like with the 3 color flags to help patients monitor their health on their own that you can hand out to them when they visit the provider. The self-management plan also provides some facts and suggestions on what families can do to improve the patient's health. These self-management plans also available in multiple languages, and they are accessible to anyone on our websites or King County here as well. There are other similar patient education resources in your local AAA, so be sure to also check with them. And if you are interested in adapting the self-management plans to use it in your area, feel free to reach out to us for more information on how to do that. Next slide. Here is a story that demonstrates this person's motivation to improve his health and wellness by participating in an enhanced fitness evidence-based group exercise program. He was extremely weak. He slept a lot every day, and he had little to no energy. He needed extra help getting out of the bathtub. He also struggled to get up and out of the house. Since he participated in Hannah's fitness program, he became stronger and he was able to do more house chores as well as enjoy dancing longer at the senior center with his wife. Next slide, please. The 5th core service area, which is our last core service area, is elder rights. And elder rights is about protecting the rights of older adults and preventing their exploitation, abuse, and neglect. And so what is elder abuse? Elder abuse refers to intentional or neglectful acts that lead to or may lead to the harm of an older adult. Abuse includes neglect, sexual abuse, mental abuse, financial abuse, physical abuse, and exploitations of a vulnerable adult. So now the abusers include adult children, other family members and spouses, as well as staff at nursing homes, assisted living, and other facilities. According to the National Council on Aging, in almost 60% of older adult and neglect incidents, the abuser is a family member. So what are the forms of abuse? Abuse comes in many forms. Warning signs may include a variety of behaviors and physical indicators that can be obvious or subtle. Physical abuse consists of unexplained injuries such as bruises, broken bones, burns, and unusual weight loss. Neglect or mistreatment includes poor hygiene and unattended medical needs such as regular appointments are stopped without communication. Other signs of emotional abuse include unexplained withdrawal from normal activities, a sudden change in alertness, or unusual depressions as well as frequent arguments between the caregiver and an older adult. Now, let's talk about verbal or emotional abuse. It includes comments or statements that are intimidating, threatening, or degrading, and other uses of power and control by the individuals. You can recognize financial abuse when there is sudden financial changes or situations where money and personal belongings are missing. Other warning signs include unpaid bills, fraudulent signatures on financial papers, or unusual changes in spending patterns. Next slide, please. So what is a vulnerable adult? So by law, it is a person who is 60 plus with a functional, physical, or mental inability to care for self, or it can be a person who is at least age 18 who has a developmental disability, or he or she has a guardian, or this person lives in a long-term care facilities like a nursing home or an adult family home, or they received in-home care services through a licensed healthcare agency, provider, hospice, or even an individual providers. And finally, or they self-direct their own care and they receive services from a personal care aide. Next slide. So the area agencies on aging have played a significant role in detecting and preventing elder abuse since its inceptions. Statistics have shown us that 1 in 10 Americans aged 60 plus have experienced elder abuse. However, only 7% of elder abuse cases are reported. Elders who have been abused have a 300% higher risk of death when compared to those who have not been mistreated. You may wonder what makes an older adult vulnerable to abuse. So social isolation and mental impairment, such as dementia or Alzheimer's disease, are 2 factors. Recent studies shows that nearly half of those with dementia experience abuse or neglect. Next slide. So the long-term care ombudsman is created to support older adults in long-term care facilities. They have trained volunteer ombuds who visit long-term care facilities to advocate on behalf of residents. The ombudsman office receives complaints and resolve problems involving quality of care, abuse, and other aspects of resident rights. The volunteer ombuds provides information to residents about their rights. They listen to the client's concerns and they work with them to resolve their problems. So anyone who is concerned about the welfare of residents in long-term care facilities, such as yourself, myself, anyone, we can reach out to your local AAA to connect to a local ombudsman office. Next slide. So this is an older patient, a case study, a testimony about an older patient that was diagnosed with dementia, and he was given only weeks to live. He was bedridden and admitted to a skilled nursing facility with hospice care. After a few months, his health was improving and he no longer needed hospice care. He also received a 30-day discharge notice stating that he has made significant improvement. However, the resident was still struggling with other challenges like not being able to verbally communicate. And these challenges made it impossible for any assisted living homes to accept him during this time. So the ombudsman office was connected when he received the 30-day notice. They visited the skilled nursing facility to observe the resident and educate him and his family on what the ombudsman office does. The ombudsman trained volunteer also spoke with the facility staff and asked them to rescind the 30-day notice. So this client story reminded us the importance of the ombudsman's advocacy efforts in helping the resident develop a care transition plan so that he can stay at the skilled nursing facility longer to improve his health and more time to fine-tune his medications. Also, he can return home from the skilled nursing facility rather than move him to another facility. So in the end, he said, "Thank you so much for the services you provide to the community." Next slide. So just tying back to the 4Ms and the AAAs here, that the AAA is an expert in providing information, referral assistance, and services that focus mostly on what matters. There may be resources on the other 4Ms that can be different for each AAA. So an example is the evidence-based health classes and self-management plans available on our website. So those are some resources for the other AAMs that are accessible to local AAAs and providers, caregivers, and patients. Next slide. So how do you locate your AAA here? Is first to locate and connect with your local AAA. You can visit the federal website, which is on the screen here, the Elder Care Locator. You may see multiple agency names and contacts in the search result. You could enter their zip code or city and state, and then it pops out the results. When you see the search in the results, they may have the same information, the same location. So be sure to look for the AAA phone number and the physical address on the list. Next slide. So again, contact your local AAA to find out the best way for making a referral when it comes to referring patients. There may be different referral form and contact at your local AAA. To be effective and intentional with making a referral, we suggest that these are key information to consider for receiving AAA services. One of them is to ask for the patient's consent before sending in a referral to us. Second, we will need to know the patient's name, date of birth, phone number, and address. Third, what services and support the patient may need. That is going to be very important to know. And last, let us know any accommodations the patient may need, such as interpretation service or accessibility needs, so that this isn't a barrier to access our services. Next slide. So how can healthcare providers help? Here are different ways healthcare professionals can help and support older patients. We suggest pay attention to older adults who struggle with ADLs and IADLs. Also look for warning signs of elder abuse, like I have mentioned earlier. Checked in with the family member or those who support the patient's appointments. Also, you can do a patient cognitive screening to help catch dementia early. And finally, refer patients and their family caregivers to your local AAAs. And our key takeaway for today is that the AAA is the right place to go to connect older adults and their families to a wide range of services and supports that promote independence and aging in place. Next. And to wrap things up, here is a short video of what the client said about us. So I hope you enjoy, and thank you so much for your time today.
So thank you so much to all three of you, the AAAs you represent and AAAs all over the nation. A really helpful presentation and a great service to our country. I do have some questions that have come in, so I thought I'd just mention those as people start thinking of questions to put into the chat box. Lisa was wondering if, Breanne, I think this was during your presentation, does SHIP run the SHIBA program?
Yeah, excellent question. SHIP and SHIBA should be the same thing. In Washington State, it is called SHIBA, but we put SHIP in the presentation because SHIP is kind of what it is known as nationally.
Great. And Linda's wondering if you know whether Montana has an in-home assistance Medicaid waiver.
You know, I think we have time. I can do a quick search real quick.
Okay. While you're doing that, I'll pose another question. Lisa's asking, what should we do if we call AAA and never get a reply? I've called our local one. I won't mention names, many times in the past and never got a response. Doesn't represent the ones here. I gave up trying to call. I used to work in our retirement community SNF. So thoughts about other strategies if they're trying to call a AAA and not getting a reply?
Well, first of all, I'll say that I'm really sorry to hear that, because that's not, I'm sure that I'm hoping that's not the intention of the service. But one thing to do is to make sure that you have the correct number. I'm sure you do if you're leaving messages. But you know what? I know that Breanne, myself, and Phung would be willing to take a phone number and try to reach out, maybe get you in touch with an individual. So I will put myself out there for that. But all I can say is keep continuing to refer those clients and trying to make contact with them, because it is life-changing and can be life-saving for some of those clients. So I apologize for you to do that, but maybe also that website that we noted, and maybe Phung, can you put that in the chat again? You can go ahead and reach out and see if there's another more local agency that would be able to help you. Breanne or Phung, if you have anything else to add.
Thank you for that. I think that's really helpful. I would say if you've made multiple attempts to contact, you may want to escalate and maybe ask for a supervisor or a program coordinator or somebody with some leadership at the agency who holds some weight, essentially. I hate to hear that people aren't getting calls back, because it's so important for you guys to be able to access these services. I will say that a lot of agencies on aging, they're pretty small. Like the three of us come from fairly large agencies on aging, and that we have, quite a few employees, and they're paid employees, they're not volunteers. So just to kind of put that into scope too, some of the agencies on area agencies on aging, especially in rural communities, they may be very small and have very few staff that are actually working for them. Some of them may be volunteers. So not that this is a good excuse, but some of what you may be seeing is that they have very limited capacity to answer the requests that are coming in. But I would suggest that if you've made multiple attempts and you're not getting anywhere, try and escalate it to see if you can talk to somebody else who might be able to help a little bit more. And then, oh, go ahead.
I also want to add that I did put the correct elder care locator website in the answer chat box. You will, once you enter your county or state and zip code, it'll populate out the search results that has multiple contacts within your area. So if you don't get an answer from one of the contact that you reach out, try a different contact. Give it some time. I'm sure someone will get back to you. But like what Breanne and Felicia said, definitely reach out to one of us and we can help you connect.
Phung, would you mind putting it in the chat box? I just changed some settings because I didn't see it come across.
Okay.
I'm wondering if we should also, we could share or try and share my screen here for the elder care locator. We could just kind of, somebody can throw us a zip code that they're looking for and we can do a search here. And then I'll answer the Montana question. Let's see, any out of Washington people want to throw me a zip code? Or maybe let's try it this way. Let's try, we'll do Boise.
There you go. You got one.
Oh, are you guys seeing my screen? Oh, no, you're not
Nope.
sharing.
Yeah.
All right, I did Boise. I didn't get the zip code. I can throw in that one. What do you want to put in there?
It was 99645.
A little bit of a slow computer today. I don't know why that's not going. I'm just going to show the results for Boise. So I put Boise in here. And so what you see in results for the elder care locator is that there's a couple, oh wait, there we go, Palmer, Alaska. Hey.
Yay, Palmer.
Hi, Alaska. So what we see here is that there's a couple of different answers that are popping up, and they're not all the agency on aging. So what you are going to be keeping a lookout for here is kind of the contact information is what's going to be most important. So they have an information and assistance program that's available that we talked about in the presentation, and this would be a great place, the website, to go and find that out. They also have their information phone. That's likely the right number to contact their information and assistance team. Their ombudsman program is listed on here as well. They also have an aging and disability resource center. Let's see, where's their agency on aging at? You might be all the way down.
I think for state of Alaska, it's the whole state, isn't it?
You know, I don't know.
I think so.
Maybe that's why I'm a little confused, because I don't even see the words agency on aging listed here, which is surprising me.
Yeah,
So,
I think it's the whole state, but somebody from Alaska can correct me.
but really, like an information and assistance program or an aging disability resource center, the contact information for those are going to be a really great place to start to help get you pointed in the right direction. So be on the lookout for those specifically. You may find that they're the exact same location. So I'll show you what my results look like here in Washington, so you can kind of see what yours may look like too. And that'll probably take a minute too. So like here in Washington, where I am in my service area, our agency on aging, we house the information and assistance program. We are the agency on aging, and we also house the aging and disability resource center, which is the exact same thing as the information and assistance team. So you'll notice what you may see on here is that the contact information is exactly the same. Like these are all the exact same place. So this is our office, the Aging Disability Resource Center. It's exactly the same for the Agency on Aging and exactly the same for the Information and Assistance Program. So you may find that in your area. There's multiple services that are listed here that are actually all the same place. And another thing to kind of point out too that I don't think we went over is your agency on aging may not be called an agency on aging, just to make things a little bit more muddy. Some of them may not have that anywhere in the name, the way that the three of our organizations do. But the elder care locator is really going to help you figure out where's the right place to go, because it's going to break it out for you. It's going to say, hey, this is the designated agency on aging, and this is what it's called. Did you guys have anything more to say on that question, or should I move to the Montana question? Okay, so I did a quick search for Montana. Kind of the lingo that I used was Medicaid waiver in home care Montana, and this is what I found. So it looks like there is a Medicaid waiver program in Montana, and there would likely be some good information on this website. I dropped it in the chat for you to check that out. What other questions do we have?
Do you mind dropping the Montana one back into the chat one more time?
Oh, yeah.
Breanne?
Let me find it again. There you go.
There. Then there's a chat that says in Alaska, we have Independent Living Center, Aging and Disability Resource Center, Southeast Alaska Independent Living Center, and Matsu links. She could be missing some. It's a big state. So thanks.
Yeah, in Washington here, we have 13 area agencies on aging. So, and all of us cover various counties. So it can be challenging finding which one serves you and your area, but we are all interconnected. So, and it's in good faith that we will make sure that you get to the right place if we do get a referral for an individual or for a patient. So we will pass it on to the right area agency on aging.
Other questions? You know, I found it particularly helpful, the case studies that you presented, because it really brought to life, I think, most of us attending this session have had experience with patients or people out in the community who have dealt with those very specific issues. And so it's nice to see how the AAAs have, you know, tackled the issue and resolved it. So thanks so much.
Yeah, thank you. It's always fun to talk about the work that we do at Agencies on Aging, because so often we're kind of like a best kept secret, which is kind of it's a terrible thing. We don't want to be a best kept secret, but we hear it all the time that people will tell us when they're engaging in our services, gosh, I wish I would have known about you guys 10 years ago when I was taking care of my mom. This would have been so helpful. And it's terrible because we've been here the whole time. We've had these services available and people just don't know about them oftentimes until it's too late. So if the only thing you take away today is that Agencies on Aging exist and we can help get older adults connected to services, that is fabulous. If you can share that little seed of wisdom with your patients and their loved ones who are helping support them, because that may make a world of difference in what matters the most to those patients.
Yeah,
and that's actually an important, oh, sorry, I was just going to say that's actually an important thing that Felicia and Breanne and Phung do in partnership with us with the Northwest Geriatrics Workforce Enhancement Center, because they're reaching out to primary care practices to let them know about all the services they offer. Feel free to chime in, Phung, sorry.
Thank you, Barb. I just want to also add that all three of us are available, and even other AAAs are available that have staff to really come into to speak with healthcare providers, healthcare practices, facilities. So you can request for us to just come and speak with your team. We could do a phone call or a virtual meeting or in-person meetings. So feel free to use us as your resource.
Jordan is asking a great question, which I sometimes have as I'm dealing with kind of just getting some things done, wondering, is there an average length of time for how long we'll hear back once we do make a referral? In other words, how long should they wait before they start following up again if they haven't heard back? Do you have a thought about that?
That's really hard to say, not knowing the individual agency on aging that you're contacting and their staff capacity. So I will share, like at my agency on aging, I also supervise our Aging and Disability Resource Center team. We get about 12,000 contact requests per year for people who are looking for services. And our turnaround time, when provider sends in that referral, our team is making contact with that person within 48 hours. That is likely a best practice. It may not be that fast at the local AAA. What I would say is probably give them a week, I would say would be a good amount of time before you give them a call back to try and follow up. Some agencies on aging may be a little bit more hesitant to provide the follow-up information that you are looking for, just due to confidentiality reasons. They may be more hesitant to give that information about what happened when they connected with the patient. So just something to be aware of. That's why it helps to document that you have patient's consent to make the referral, because it will likely make it easier for the agency on aging to provide that type of follow-up to you.
And I will say at our area agency on aging, it's between 48 to 72 hours of contacting the client. So that's it. We are here at Southeast.
For our
Great.
Seattle and King County area, it does vary as well, because we do collaborate with community providers, so they have a different process of getting back to referrals. I would say our best practices really varies depending on the types of services and programs, but definitely reach out to us and make a referrals, and someone should follow up, and they can share that information.
And I think there's one more thing that I would add is it's helpful, like to make a good referral. It's helpful for you to make that referral on the patient's behalf. Not that you guys don't have enough to do anyways, and you don't have full plates. Just one more thing, right? But if you can make that referral for somebody, it's going to take that barrier off their plate, and they're going to be more likely to access services. The other thing is if you're making that referral and you're able to give the agency on aging a heads up as to like, hey, this is what I'm looking for help with, what this person is wanting help with. The agency on aging will likely be more successful when they reach out to that person if they can say, hey, I got a referral from Dr. So-and-so at this clinic, and they said you needed help with X, Y, and Z things. We're going to be more successful if we have that type of information up front, because our intake teams can really sound like telemarketers when we reach out to people. And luckily, seniors are just a little more savvy to being scammed now than maybe they were in years past. So some of them, if we don't have that queuing information to provide to them, like, hey, we're reliable, we're trustworthy, we know your doctor, they sent this to us, they asked us to call you. They may not even want to answer the phone or listen to the voicemail or anything like that. So the more info that you can provide, the better it's going to be for us when we connect with them. We're going to be more successful.
Boy, is that a great tip these days. Sharon said, thanks for your services and support during COVID. The agency in my area provided rides to elders for COVID vaccines, food delivery for elders in quarantine. So thank you.
Yeah, well, you're welcome. That wasn't us, but it was, that is really cool to hear. Agencies on aging are really flexible. We're adaptive. We like to meet the needs that are there. So that's really cool to hear what other people were able to do, because all the services are different depending on where you go. They really try to meet the needs of the local community. So that's fantastic.
Okay, well, thanks very much to all three of you and all of the work that you do. Everyone, thanks for attending, and I will see you next week. Bye.
Thank you. Bye-bye.